Hi, my name is Ashley Gallegos, and today I am going to be showing you how to perform oral hygiene. So the first thing that you want to do is knock before entering. Then when you have entered the room, you are to identify your patient. Then you are going to, if your patient has any visitors, just politely ask them to wait outside until you are done performing this procedure. Then you are going to identify yourself with your name and your job title. And before and throughout this procedure, you are to explain every step that you are giving to your patient. Also, throughout this procedure, you are to protect your patient's rights as well as being gentle with them. So the first thing that you want to do is wash your hands. Then we are going to gather all of our supplies. So the supplies that we are going to need today are a towel, gloves, toothpaste, and a soft bristle toothbrush, floss, paper towels, a kidney basin, a cup that we are going to fill with cool water, and then also mouthwash. So after you have gathered all your supplies, you can wash your hands again. Then we are going to identify our patient using 2 identifiers. And then we are just going to provide for privacy. So close the curtains, close the windows, shut the door, anything like that. And now we are just going to raise the bed for good body mechanics, as well as making sure that the bed wheels are locked. And then we are going to position our patient in either the sitting position or the side lying position. So I am going to be positioning my patient in the sitting position. So he is in the sitting position now. And after that, also if they have bed rails, according to their care plan, just make sure that they are up besides the side that you are working at, but my patient doesn't need bed rails, so I don't need to raise or lower any bed rails. So now we can put on the gloves, and we are going to put the bath towel over my patient's chest. So bath towel is over my patient's chest. And this is also filled with cool water. And so now I am going to take the toothbrush and I am going to put it over the kidney basin, and I am just going to pour some water over the toothbrush to get it wet. And now after that, I am just going to apply toothpaste. And now I can start brushing my patient's teeth. So the way that you want to brush their teeth is horizontal, and you are holding it about at a 45-degree angle, and you are just doing short strokes, and you are brushing from the gums to the crown, and you are just brushing back and forth. So make sure you brush it. You want to get the inner, the outer, and the chewing areas as well. And then after that, you are going to take the kidney basin as well as the cool water in this cup. And your patient is just going to rinse his mouth now. He's going to be drinking some of the water and just rinsing his mouth, and then he is going to spit out his water in the kidney basin. And then I am also, if he gets any water on his mouth, I'm just going to wipe it off with the paper towel. And then also, when you place all of your equipment and supplies on the bedside table, just make sure you place paper towels over the bedside table, and then your supplies are on top of the paper towels. So after this, he's just going to rinse out the water, and then he's going to take another sip and just rinse out all the toothpaste, and then he's going to spit it out again, and we are just going to repeat this process until the toothpaste is fully out of his mouth. And now I am going to get an 18-inch piece of floss out of this, and I'm going to floss his teeth now. And the way that you want to hold it is you want to wrap it around your middle fingers, and then you just can hold it with your thumb and index fingers. And then now we are going to be flossing our patient's teeth, and the way you want to floss is you are going to start on, also when you brush your patient's teeth, just don't forget to brush gently on the tongue, the roof of the mouth, and the cheeks as well. So the way that you want to floss is we are going to start on the top of the mouth on the right side, and then we are just going to work our way to the left side. And after every second tooth, we are just going to get a different piece of floss that we are going to floss, and we are just going to floss up and down. We are starting from the crown, working our way to the gums, and you want to be gentle. You don't want to be stabbing them or anything like that. So I'm starting on my patient's right side and just working my way to the left side. Then after that, we are going to do the bottom teeth as well, and we are going to start on the right side again and work our way to the left side, and make sure you are switching the floss out after every second tooth. And then after that, we could just dispose this, the piece of floss. And then your patient, they can use mouthwash or any other substance that they use. So my patient uses mouthwash, so I am just going to pour some in there, and then he is going to rinse his mouth out with the mouthwash. And then I am going to get the kidney basin, and he is just going to spit out the mouthwash in the kidney basin. And then I am just going to take a clean new paper towel and just wipe off his mouth if mouthwash got on his mouth. And I'm going to be disposing this paper towel as well. And then after that, I can take off the towel and put this in the laundry bin. And then I can remove my gloves and then dispose my gloves and wash my hands. And I could put on a clean new pair of gloves. And then I am just going to be cleaning my kidney basin. I am just going to be cleaning it and then making sure it's completely dry with paper towels before I put it back where it's supposed to go, as well as this cup that was filled with cool water. And then just dispose the gloves and the paper towels that you have used, and then put the mouthwash back, as well as the floss and the soft bristle toothbrush and toothpaste. And then after you have put away all of your supplies, you are going to take a clean paper towel and just wipe off the over bed table. And then since I moved the over bed table to a location that was good within my reach when I was performing oral hygiene to my patient, I am just going to move the over bed table to a location that is safe, where my patient or his visitors won't trip or fall, anything like that. And so now, if your patient had bed rails, you could raise them, which my patient doesn't, so I don't need to raise them. You could put the bed back, lower the bed, and you could position them in the line position, as well as making sure that the bed wheels are locked. And then you can also, after you clean all the supplies, just make sure you take off your gloves, and then you can unscreen the person, do a safety check around the room, put the call light back or any other items within their reach, and then you are to report and record your observations, and that is how you give oral hygiene to a patient. Thank you.